I'm excited to welcome Ciaran Fairman to the podcast. He's an assistant professor of exercise science at the University of South Carolina and the director of the Exercise Oncology Lab. Ciaran earned his PhD in kinesiology from the Ohio State University and went on to complete a postdoc fellowship in exercise oncology at the Exercise Medicine Research Institute in Australia. He's done some incredible work in the field of exercise and cancer care, and I cannot wait to dive in with him today. Ciaran, how are you?
Good, man. I appreciate you having me on.
Yeah, it's like I was so happy when kind of my friend that I don't know his own since become your friend when he introduced us. I think it's an absolute perfect fit, and it's good timing as well, given that it's Cancer Awareness Month. I'm super happy that you're able to come on and share your wisdom with us. Before we do dive in, like the outline for today's podcast is going to be around the role of exercise in cancer treatment. I'd love to speak to you about maybe the mental health side and well-being in cancer survivorship as well, and then get some practical exercise tips for patients, and then speak a little bit about caregivers as well. So there really is a lot I'm excited to cover with you. But before I do jump into all of that, I'm just really wanting to learn about like what drives you, what's your passion to do this work, like what do you love most about what you do?
The reward that you get from seeing people recover parts of their life. So kind of a brief background. My career, my direction initially was going down the road like sports science and strength and conditioning. And I was really passionate about trying to go into like, pro football or even come home and help Gaelic athletes out and stuff like that. But I did a couple of internships and I was in like professional sports, and it was really, really cool where at the elite level of human performance, you have to worry so much about how precise you are in terms of training loads, in terms of rest and recovery, in terms of complementing that with nutrition, and then even a psychological aspect. And it was really cool. But I realized I wasn't as passionate enough about it to make the impact that I wanted to. There's incredible sports scientists out there that are more skilled and more talented than I am. And my ma got breast cancer early into my college career, and kind of listening to what she was going through, she started to put on weight, started to lose a lot of strength and muscle and get weaker. And then kind of like the fear of falling and all these other things. And it was frightening to hear. I was living in the States at the time and couldn't get home to be with her. So it was a very scary time for all of us. And kind of listening to all of the things that she was experiencing from treatment, you kind of put two and two together and go, it makes sense that if all these things are happening to your body, they are also the things that exercise and training can help people. So it was a really pivotal point in my career. I kind of did a 180 in terms of seeing what I could do from an exercise nutrition perspective. And that kind of was 15-ish years ago. And I just went down the rabbit hole ever since of being like, whatever I can do to help improve the community that I'm in through my research, but also, try to build more evidence in support of how we can use exercise and nutrition to help people with cancer during and after their treatments.
Wow, that's a pretty impactful and a very purposeful journey as well. And I know, like you were a high achiever as well. You were working with teams in the MLS previously, right?
Yeah, I was working in that space. And yeah, I mean, listen, like I'm a driven person in general, and uh, I'm lucky in that, like I'm just really lucky that I found what I liked. I was kind of lost a lot as a kid in school, and then even through early college I didn't really know what I wanted to do, and kind of finding this has given me so much purpose in it is what drives me, because it's a really fulfilling career, but it's also demanding as well in terms of maintaining an academic career and trying to like feed your community and be a leader in the community and stuff like that. It can be demanding, but the drive is so strong, and like I'm determined to try and change the way we think about cancer rehab, at least here in the US, and hopefully, bring that across different countries too.
Yeah, what would a day in the life for you look like? Is it like super research heavy? You mentioned about supporting the community, so you probably have to have some bit of like a social aspect or putting yourself out there
Yeah,
aspect
yeah.
as well.
Yeah, I mean, it's also, to be fair, one of the things I love about the career, it's so varied in day-to-day aspects. So at a place like South Carolina, the university, it's 90% research. So I teach some core classes within the exercise and health science major, and then outside of that, so much of my job and incentives are doing research. So I could be writing grants to government agencies to try and secure funding for research. I could be trying to publish data that we've accumulated, and we could be in the clinic doing our research itself, like training people or collecting data. And then to your point, the thing with with cancer rehab and this field in general, it's still so far behind that the community, the clinical community, the medical community isn't necessarily fully sold on it. And the other part is like, to be fair, the main job of any sort of oncology professional is to get the tumor out of your body. There is a perspective that while it's important that they see like these changes that happen to the body, a lot of the perspective is like it's collateral damage. You know what I mean? Like it kind of take a little bit of loss of muscle and strength if we're making you free of the disease. All of which is to say that like so much of my job also involves engagement with clinicians and hospitals and going to tumor board meetings to make sure that we have a presence, because it's one of those things like out of sight, out of mind. If it's the same for kind of any supportive care, whether that's psychology, nutrition, even social work and stuff like that. In the States in particular, the financial burden of treatment is insane. The primary purpose of hospitals here is like get the tumor out of your body. And then secondary to that is like, oh, listen, all these other things can be helpful. So I've learned a lot early in my career of how resilient you have to be and how determined you have to be to just kind of keep putting your foot in the door and keep giving yourself a place at the table to be able to give access to people who need it.
Is that incredibly frustrating for you? Are you at the point where you just understand the system, it is what it is?
So that's exactly what my trajectory was. My early career, the frustration was insane. I just couldn't understand like how beneficial it can be and how many people are ignoring it. Well, ignoring it, so to speak.
Yeah.
And I was just so frustrated of like, everyone should be getting this, or at least be recommended to talk to someone like us who can help support them and decide what's safe and what's right and whatever. But the more I've gotten experience in the medical field at large and see like, right, hold on a minute, you've got an oncologist who has 40 patients in a day. So on average, they've got anywhere from 7 to 12 minutes with the patient. And in that 7 to 12 minutes, they've got to talk about if their cancer has progressed or not, explain what treatments they're getting, explain what those treatments mean, what they're going to do to their body, how much it's going to cost, their schedule. The last thing on their mind is going, oh, and by the way, you should try to do a bit of exercise. The more experience I've gotten, like it's less frustration with the community and more a desire and determination to figure out how we can create space for ourselves there, which is to say that like we don't need oncologists to be the ones prescribing exercise. We just need them to act as champion. And if we can change, because this is also like you have to work institution by institution because there's so many different cultures and readiness and all the rest of it. You have to try and change the culture of that institution so that it's an opt-out rather than opt-in, such that this is just a part of your care. You meet with your radiation oncologist, you meet with a medical oncologist, you meet with an exercise physiologist. You have to decide that you don't want to do them.
Yeah. So like you're saying, right now it's a extra, we'll say, or like a supplement, but you want it to be like severely, which I feel like rightly so, severely ingrained in terms of the treatment process.
Yeah, exactly. Like it would be an afterthought. There's not many. Well, it's much more rare to find an oncologist who would outwardly say that is not appropriate. But it's more common to find people who say this is brilliant. I think it's a great initiative. I'm too busy. I don't have time, and our infrastructure isn't set up for this. So like, if you can make it work and don't impact their clinic flow, go for it. So that's kind of a lot of what you try to do. Like I did my postdoc over in Australia and got some really good training. And I thought I was kind of like building this reputation or evidence in the field or whatever. And then I came to South Carolina, and rightfully so, no one knew who I was or what I was doing. So there was no trust, there was no rapport, there was no relationship. So I'm here 4 years now, and it's taken me to go to like 2-ish to really build like solid community connections in the oncology community to really build their trust and make sure that they know that I'm taking care of their patients and that our lab and our staff are trained well enough to understand what the cancer experience is.
I mean, I'm not really surprised, but it is amazing that it has to be done area by area, and like you have to almost
Mhm.
go out and fight your corner in a way to promote something that you would think would be like, in my opinion, just so obvious.
Yeah, and like it's kind of like both. You need the bottom up, which is like all of us going to individual communities, and we need to upskill workers and all the rest of it. At least in the US, there's definitely a top-down approach that's coming, which is a lot of researchers in health policy are trying to generate sufficient evidence that outside of like, can exercise help you tolerate treatment? Can it also improve treatment efficacy or effectiveness? Can it influence mortality rates? Can it influence survival? So that builds a body of evidence. So in this country, at least, insurance will pay for it, and then it might be mandated across the country. So I think having both prongs will be helpful. Of like top down, it's mandated. Bottom up, you have people who are skilled enough to do it. But that's specific to the US. So Australia, for example, their clinical exercise physiology infrastructure is incredible. exercise physiologists in Australia are on par with physical therapists. They're kind of deemed the same respect, whereas like in the US and Ireland, it's not really that way. So when you get any sort of chronic disease in Australia, you get like 5 free sessions with an exercise physiologist who can like look
Wow.
after you. Yeah. And then Germany has 50. So Germany's infrastructure, you get 50 free sessions. So I've been lucky to be able to like been exposed to different countries to see kind of like what models might be advantageous. The US is a profit-based healthcare system, so it's difficult to make exercise profitable, especially in the clinical space. So we're trying to drive the policy so that insurance reimbursement will cover a lot of it.
I think just building off that, can you explain how exercise can impact the outcome of cancer treatments?
Yeah. So I guess stepping back a bigger picture, like I've been doing this for a while, and you're always getting the question of like, why should they? When I talk about it, all I have to do is list all the side effects and all the impact of treatments. And then it basically becomes of like, well, tell me why they shouldn't. Because based on the type of tumor you have, the stage of tumor, which will influence the type of treatments, the dose of treatments, the sequence of treatments, and the combination of treatments. So like solid tumors, for example, almost everyone gets surgery. So inherently you will have some sort of tissue change, maybe some range of motion difficulties around that tissue or around the surgical site, some weakness around that surgical site. And then let's say you get that paired with chemotherapy, and chemotherapy is there's hundreds of different chemotherapy agents and all given for different reasons, but they're generally systemic. So they're flushed throughout the body, and that's what happens when you see like people losing their hair and their taste changes and skin and nails and stuff kind of gets a bit out of whack. They're the visual changes, but
Mhm.
the really profound changes from chemotherapy are things like cardiovascular damage, so damage to the heart and the structure and function of the heart. You could have pulmonary damage, so damage to the pulmonary system and the lungs. And muscle weakness happens very commonly, where you have the chemo can actually signal the muscle to start to waste away. Then you lose muscle strength, you lose bone health, you gain fat mass. And so like you pair up all these things and go, it's no wonder people's bodies are destroyed. And there's no pharmacological agent that's going to combat them as effectively as exercise. So we know exercise is really powerful at improving cardiovascular health. It's really powerful at improving muscular strength and body composition, and improving muscle weakness and stuff like that. So you start to pair all those together and go, it's a no-brainer. And the irony is, generally, the worse your trajectory is going to be, the more beneficial exercise can be if you start it early enough. Because one of the most challenging things about exercise, particularly during treatment, is it's not that you're going to see massive improvements. It's not the goal of exercise during treatment. The goal of exercise during treatment is, can we keep you looking and feeling the exact same 6 months from now? Because what happens otherwise is you do see gains of fat mass, loss of muscle mass, you start to see frailty, nausea, weakness, all this type of stuff. So if we can keep you where you're at 6 months from now, you're in a great spot. You've gone through this really traumatic period. The challenge to that is, if I asked anyone to go, hey, listen, you're going to come to the gym 3 days a week. You're going to do that for 6 months. It's going to be really, really hard, and you're not going to look or feel any different. They're going to be like, there's no way I'm
Yeah.
signing up for it. So it's the really challenging part of that is more so the behavioral aspect of trying to keep people engaged. There is some really cool ongoing research that I hesitate to say because we don't really know how it's going to shake out, but there's some early biological work that is suggesting that, particularly cardiovascular exercise, if you, at least in animal models, if you train animals during chemotherapy receipt, cardiovascular training can normalize some of the vasculature, so some of the vessels that help deliver the drug, which allows the drug to get to more parts of the tumor and allows the drugs to be more effective. So that's kind of been in our field for about 15-ish years, of like this kind of idea of like, maybe you can also increase the delivery, enhance the effectiveness of chemo agents in particular. I hesitate to say that because there's some ongoing trials now that will be finished up in a few years, and we'll probably have some more answers to that. But at least that's the idea of not just like, can we minimize symptomology, but maybe can we make you more robust and improve the effectiveness of the treatments themselves.
I think that's an interesting kind of concept in itself, and I agree what you said when you mentioned about it's really difficult to get someone to engage in this exercise, and telling them basically like it sounds like a damage limitation thing, like you're not going to see any quote unquote gains that most people might associate with exercise or the gym, but it's doing such an important part in terms of like, is there any studies to show like the mortality decrease rate or anything specific like that?
Yeah, generally there's some fairly decent, like large epidemiological evidence. Now, it's not randomized controlled trials. There's a couple of those that are wrapping up at the minute that are larger in size. But generally the epidemiological evidence follows that the more active you are consistently throughout life, the lower your risk of cancer related and all cause mortality. So there's definitely some strong evidence in support of lifestyle behaviors and maintaining that. And uh, the other way I'd conceptualize it is think about your grandparents or your parents, depending on what age you are, and like what happens to them once they age. Heart health is important, and it's great to get up to an aging, the healthy age, so to speak.
Mhm.
But what happens is people stop doing any sort of strength training. So that means then it's hard to get out of the chair. Like you see the granddad rocking chair, like they have to tip over if they fall back in the chair and then they're stuck for the night. Or carrying shopping in and out of the car, or you're carrying washing up a stairs and the dog runs out in front of you and you slip and fall. Like
Yeah.
those are all really high risk factors that mean it no longer becomes safe for you to live on your own. And so that means then you're going into assisted living. And like that, once you kind of reach that threshold of disability, meaning it's very difficult for you to maintain your life independently, that's a spiral that goes pretty quickly. So what happens in the context of cancer is all these changes happen to your body. You gain fat mass, you lose muscle mass, you lose bone health. The other part that happens with that is like peripheral neuropathy, for example, is very common with chemo agents, and it causes a lot of changes to the nervous system in the extremities and hands and feet. So you got a lot of grip issues, you got a lot of balance issues. So now imagine like you've gone through an experience, you come out the other end, you have less balance, you're weaker, your stability's off, your muscle strength isn't there. So now when you trip over, walking through the house over your hoof or whatever, you don't have the ability to put your foot out quickly, stop your fall, stand up, and regain your balance. And then because your bones are weaker from the treatment, that fall that happens now turns into a fracture. And so that's like the epidemiological evidence kind of generally supports that. But on an individual level, that's the experience of like, we need to keep people out of that disability threshold. So we see across cancer treatments, we see this dip, the treatment suppression, inactivity that goes with it. There's a lot of depression and anxiety and fear that comes with cancer that makes it difficult to participate in exercise. I've never seen anyone spontaneously start to exercise when they get cancer. And I've never seen anyone kind of who has been fit not struggle to stay fit and kind of get back to their high level fitness after. So we basically treat people, get the tumor out of their body, and then leave them in a really vulnerable condition that they might ring a bell and say you're good from cancer, but then they're in this vulnerable condition for the rest of their life. That's where it's really important that we come in and really help them regain their fitness and life.
Yeah, you're coming in at a point when I'd say motivation is at an all-time low, if not
Yeah.
non-existent as well, and you're trying to ingrain these habits, which are difficult to ingrain, like if you had no situation or nothing going on in your life as well. So it's definitely a tough situation for you to come in, but it's also really important for we'd say the patient or the person as well to engage in something like that.
Yeah, yeah, absolutely.
And I think everyone has a story similar to what you mentioned. Like I was just thinking of my grandmother when you were talking. She grew up and lived in my home house, and it was like the classic. She was in, we'll say, semi-care with us, and then fell, broke her hip, and like that was quality of life plummeted at that point. And I think that's so common, like the difference between that happening versus having enough strength to like be able to, when you're falling, like put your hand out and not suffer that broken hip. Like that can make all the difference too to people.
Exactly. Yeah.
I'm curious, Ciaran, like what's the number one conception people have about exercising during cancer treatment?
Safety. There's rightfully so much fear around safety, and like I I can get on a soapbox and get really passionate about this, and I have to be careful in offering like the caveats around. There's definitely are things that you need to be mindful of during cancer treatment. Immune system is absolutely shot, so you have to be very careful of the environment that people are exercising in particular with like advanced stage cancer, where the bones or the cancer might have spread to parts of the body, such as the bone. So bone metastases or cancer that spread to the bone can be really challenging to deal with. The risk of fracture can be higher and stuff like that. So there's certain, like, the general statement of exercise can be beneficial has to be given with some asterisks around, as long as there's guidelines in place and barriers that we make sure that there's checkpoints to keep it safe. But in general, like, think about cardiac rehab. Like, you get a heart attack or whatever. 40 years ago, you were told to bed rest. So that's a really early field. And the first study in exercise oncology was published in the late 80s. So for the first 10 years, it was only like, is this safe? Can people like walk and stuff like that? And it's only in the last like 10, 15 years where we've actually been exploring different types and doses of exercise. So as far as like a field of evidence, we are brand spanking new. And we're still trying to understand if you parallel it to cardiac rehab is relatively simpler in the sense of there's generally some sort of damage to the cardiovascular system. You have to rehab that system and get it back to normal. And there's phased approaches to doing that. In the context of cancer, the puzzle is infinitely more complex because is it a solid tumor? Is it a liquid tumor? Is it childhood cancer? Or is it adult cancer? Is it stage 1 cancer? Is it stage 4 cancer? Are you getting chemo and radiation? Or are you getting hormone therapy or whatever? So, for example, prostate cancer, the main driver of prostate cancer growth is testosterone. So the treatment for that is to take testosterone out of a man's body. So you undergo hormone therapy or different therapies that either stop the production of or the action of testosterone. So inherently, when you take testosterone out of a man's body, lose muscle mass, gain fat mass, lose strength, lose bone health, body image is destroyed. In a lot of cases with prostate cancer, sexual dysfunction is all over the place. So you're dealing with a really intense psychosocial impact, the physiological impact of the treatment. Compare that to, say, head and neck cancer. Head and neck cancer is any cancer neck and above that isn't the brain. And, in the US in particular, where there's a lot of people do like chewing tobacco, you could have like cancer in the jaw. So then the treatment is, let's remove part of the jaw. And then you've got to get radiation to your neck, throat area for 5 days a week for like 6 weeks. And then you're getting chemo once a week on top of all that. So those individuals are losing weight at a rate of like 10 to 15 pounds a week. So the rate of weight loss is insane. So pair those two against each other, they all fall under the umbrella of exercise oncology. So then that kind of gives you an idea of how complex it is trying to figure out what does the person with prostate cancer need versus the head and neck versus maybe like early stage breast cancer where they just got surgery and didn't get any systemic therapy. They might be able to handle a lot different type of exercise. So it's incumbent on us as professionals to have a general idea of the physiology of the disease or the pathophysiology of disease, the treatments and their side effects, so that we can then create an infrastructure that makes it safe for people to exercise during treatment.
There's a lot to unpack here. Like my first
I felt
thought
that
is,
as I was talking.
this is not a case of like, oh, you're suffering from cancer, here's a program for you, off to your local gym you go. Like, it's like complex, it's beyond complex. And I even thought about an individual's journey. What if they start at maybe a certain stage of cancer and they're like, you're providing a program, and next thing things worsen and they look like they're going the opposite way, and now you're still trying to tell them, but you still have to do this is important.
Yeah.
And yeah, I can imagine you've been in some or been in some situations where like you've experienced people going through those situations as well.
Yeah, and you know what? Like it can be heavy and there can be a lot to it, but at the same time, it can be really, I don't know, like fulfilling and rewarding. So when I was in Australia, we worked on this really interesting study where we were doing like metastatic castrate-resistant prostate cancers, like end of life, nothing's working. They're pretty much told that like, you're gonna pass away from this disease. We're trying to see like if we could prolong quality of life and quantity of life and so on. And you're seeing these men who are in their 60s, 70s, and 80s coming in and train 3 days a week, knowing that they're training, but they're still getting weaker and they're still progressing. And then like at some point, something happens where it's just a tipping point where the treatments progress, the disease progresses and the treatments can't keep up, and they just, they pass away within weeks. And it could be really powerful experience because you get really close with them. But then there's a beauty in it too, where some of them have the most incredible perspectives on, particularly when they get to the older age of like, I've lived it all. I'm kind of okay with this being the part. And one of the most powerful things about what we do, I think, to your very first question, is if you look at the experience of an individual cancer, they are consistently burdened with appointments of like, what's happening to me? Like in the States in particular, how am I going to pay for this? Someone who works in like, you know, a rural county and has two jobs and is a single parent, and you have to go to the hospital 5 days a week, like, am I going to keep my job? And if I lose my job, can I pay for the house? And it's a really difficult experience. And there's so much stress and anxiety. And then like, is this thing going to kill me? Like, can I care for my kids or whatever? So we are lucky that of all the things that are going on in their life, we get to be one of the few, if only, places that they can come where it's a safe haven and it's good energy and they have control and autonomy over a part of their life, where so much of the rest of the experience is just stuff that's happening to you. You got to go here, get this treatment. This is happening to you, and you're just kind of like losing control. So it's really important that we make sure we foster a really enjoyable and motivating environment for them to want to be able to come and hang out.
Yeah, in the examples you gave there, you're playing a really important role in people's life. And it sounds like we've obviously touched on this earlier, right? There's the exercise, first thing comes to your mind is like the physical, we'll say, benefits of it, but we're really touching on kind of the mental side as well and the emotional benefits. And I'm curious, from your point of view, how does physical activity help cancer survivors regain control of their mental health post-treatment?
So I think there's both the act of participating in physical activity and then the environment in which you create around the physical activity. So in general, to the point I just made, you have all these things happen to your body. So one of the best things you can do that's within your control is to engage in activity that will help manage some of those side effects. In addition to like just the mental health effects of exercise in general can be really beneficial. But what we found to be even more powerful is the community that you create within the activity. So it's one thing, to your point, like, right, let's say I'm in my early 20s and I'm a fitness instructor and I'm doing a group fitness for people with cancer. They can't relate to me. There's nothing about me being like, oh, you know, I know things can be hard, but keep going. They're like, you have no idea. Whereas there's a tremendous power in creating peer support. So making sure that the community is there that has shared experience. So you've got two lads who've got prostate cancer go, geez, you know, like I'm having incontinence and I have trouble going, like controlling the urge to go to the bathroom. What are you doing? It's really embarrassing. And they can have this little side conversation that helps each other out. Or, you know, someone's having marital issues with their caregiver because it's a really powerful experience. And there's a few of them are able to kind of chat through that. So the shared experience of cancer is so powerful. And if you think about physical activity as a medium for that, it's not necessarily about participating in activity. And it's oftentimes like, right, you didn't really do that much today, but you were able to sit beside someone for 15 minutes and have a chat that might have changed your week or whatever. And then from a behavior change perspective, one of the more powerful things, again, to that point is not necessarily that like I'm telling you what to do, of like, oh, you should put your shoes out by the door so you make sure you go for a walk. It's more so like peer-led solutions. So I have no idea what it's like to have the experience of having an ostomy bag with colorectal cancer. So if you feel uncomfortable going for the swim because this bag is outside your body and you don't really have control of your bowels and stuff like that, how has someone else with the same experience managed to, you know, make themselves feel more comfortable or come up with solutions? So there's so much power in the community and the environment that you create. And again, like oftentimes it becomes less about the activity and more about the psychosocial aspect of just showing up and having a chat here or there and all the rest of it.
Is there intentionality behind the community building aspect, or is it just organic based that like it's going to naturally happen anyway, given the environment?
Both. I think my training is part physiology and part behavioral science. So during my PhD, we did a lot of theory-based informed like behavior change interventions. So there is intention in how you do that. Now, there's ways that shakes out. So, for example, living in the States, and kind of like the thing with university settings is like oftentimes you get more affluent people. Like it's the way you do it is different based on the community that you're working in. So, for example, like if we were in a university setting and you're trying to engage like community around you, that might be more affluent. So you've got people who are coming in who are more, maybe have a better capacity to talk through their emotions and whatever. So you've got some men who will sit around and chat about how they feel. Go out to rural Monaghan to a lot of farmers. They're not going to sit around and chat about how this is making me feel. So the intentionality is there, but the outcome might be different. Of like these lads might, you know, go for a chat after, or they might go for a pint after, or whatever. One of the really cool ways I've seen this done is in Denmark. There's a program called FC Prostate, and it was basically a football program for men with prostate cancer. And so again, like it was kind of taken into the idea, like the culture of Danish people, the likelihood of different environments of facilitating conversations. They're like, well, listen, the Danish lads, like Denmark as a country is harder to like set up these specific sites. So let's set up this national football league, have some lads get together a couple of days a week, have a bit of crack, and maybe then during their warm up or their after, they're going, something's happened and whatever. So I think that's what's really cool of like if it's designed with the intention, the community kind of sorts out like how it shakes out. But then outside of all that, to your point, there's such a powerful community in cancer in general. Like I haven't seen it in any other chronic disease that I've worked in. It's just there's something life changing that happens with the cancer experience, and because I don't talk about statistics in class. Probably should do, be a better professor. Because all I have to do is say, raise your hand if you've had an immediate family member affected. Few people throw their hands up. Raise your hand if someone in your extended family has been affected. Raise your hand up. And then if you go out to like as far as just like extended family and friends, everyone's been hit. I think there's also an idea of that where there's such a shared powerful experience of like, if you know anyone who's had it, it's just a really intense experience. And with that, there's just so much desire to be a positive source of support in there.
And do you think there's enough awareness around the mental health benefits, we'll say, of exercising among oncologists?
No. And if you look at why, there's very good reason. So I did my PhD at Ohio State and I took some classes in our med school. And in their med program, they do 4 years of medical training after college. And then they do another like 2 or 3 years of residency. They take like 8 years to become like trained professionals. In that 8-year period, they might get one class on lifestyle medicine, which includes exercise and maybe some psychology and whatever. So like there's no training for medical professionals to actually understand it, and it kind of relies on their own desire or awareness. So I do think there needs to be more training like earlier on. So it's again, like it's just a natural, you're changing the culture. The more medical professionals you train that really understand the physiology of exercise, that it's not just kind of like woo-woo kind of stuff, you'll see that there's real evidence behind it. When you said awareness there, one of the important things I think worth mentioning is there's incredible awareness around breast cancer. It's Breast Cancer Awareness Month. There's so much power around like how can people with breast cancer exercise and do all this stuff. And it's really important that we have that beacon. But I think at the same time, there's considerably less awareness about every other cancer type. And so again, like unless you have a personal experience with someone who's gone through cancer treatments or whatever, you intuitively, when I think cancer, think of breast, maybe prostate, maybe lung, maybe colorectal. No one's talking about sarcoma. No one's talking about pancreatic. And like they can be really difficult diseases to experience as well. So I think we need a broader awareness within oncology of how this can also help these different tumor types or even more rare tumor types.
Yeah, so broader awareness, maybe more specific training from that aspect, but also more training needed around the physiological benefits as well.
Yeah.
Random question for you. I'm curious to know what surprised you the most when you started working with cancer patients and exercise?
Their resilience. And it's one of the things that like I am probably the most passionate about. When you start to work in chronic disease, there's so much fear and bias and misconception around their ability to tolerate exercise and be robust from it. So I want to caveat this by saying I'm not saying go absolutely nuts and send everyone to cancer to a CrossFit class. It's not what I'm saying. What I am saying is too often we baby people and we put our fears or biases on them. So one of the things early in my career I started to see of like, you got people with cancer and sure they're weak and they're sick, but like, they might be doing, have a couple of pounds in their hands doing dumbbells and all the rest of it. But then they're going out and carrying 30 pounds of shopping in now this car or whatever. So I think we in the medical or in the clinical exercise physiology world don't give people enough credit for how resilient they are. They're getting chemo flushed throughout their body. Doing a few squats isn't the thing that's dangerous. You know what I mean? So I think the more we've actually been able to push people, the more powerful they've experienced it. Because like, why do people not go to physical therapy? Because it's boring. Like no one wants to go in and like stick their leg in and out and do a couple of resistance bands. And if you make exercise like that, why would anyone want to go to it? And so like what's a true line for me is like, I just always think about like my mom, my granny and what their experience would be like. And that's the standard. You have to have the same level of care of like, it is difficult for someone who's never exercised or may have like, comorbidities. So someone with cancer, if you pick someone 65 out of sky, chances are they don't just have cancer. They might have diabetes, they might have COPD or osteoarthritis, and then a bad shoulder from sports years ago. So you have to deal with the person on the individual level. But if you take all that into context and then you enable them to push themselves, you're giving them more power and more self-efficacy, which is your confidence in your ability to do stuff. People respond to challenge well, providing it's the right type of challenge. So I think what frustrated me earlier on was kind of seeing how people were treated, and then kind of what has continuously surprised me and excited me was seeing how robust and resilient people are, and then how much benefit they get from it. I'm talking like 10 weeks of training, you're having people lose walkers and they're getting back to like picking up their grandkids or going fishing and stuff like that. And like oftentimes in our research, we do focus groups with people at the end, because in research, you do like fairly generic like forms and questionnaires of like, did you sleep better out of 10 or whatever, which is good. But what's really powerful is like them being able to sit down after 10 weeks and going, this changed my life. I thought I was going to be bedridden. I thought this body that I existed in was going to be my new body. And like within the space of 10 weeks, I now have a completely different outlook on life. And it's magic every time.
I would say seeing even one of those testimonials or one person say that for you surely makes everything you're doing just worth it.
Huge, man. And what's most exciting to me, like I feel really, really lucky that I've just been fortunate to land in a career that I get a lot of fulfillment from. And it comes from a lot of different places. Like one of the most exciting parts of what I do, I think, is being able to generate evidence and then going out to like talk in different countries or conferences or whatever and share what we think in the hopes that like other people will take it on board. But that's a long process. Like it takes like 2 or 3 plus years to get evidence to go and present your data. So it can be an exhausting process. But in the time being, you get these immediate hits of like just love and gratification by having these 10-week, 8-week, 12-week programs, and you see your local community experience benefit. And like it'll bring you a tear to your eye of like what they say of how much it impacts them. And one of my favorite parts about the stage of career I'm in now is I have my own lab. So, I've got a team of whatever, 25 people. So they're all getting trained up and starting to see what happens, and seeing them see the experience of the people and then seeing them get so excited and being like, this is the thing I want to do. It's incredible.
Yeah, it's unbelievable. Like meaningful. Like I don't even know does that word do justice to what you're doing. Going back to the exercise, you kind of mentioned about 10-week programs and challenging people at the right amount or right level. But what's the smallest amount of movement you've seen make a difference?
Anything more than what you're doing, because that extends to any person, whether you're inactive and you have a hard time getting out of the chair, versus you are a fit person and you're going to see a dip during treatment. There's really strong benefits to just moving more. And we have to be careful, because this also comes down to the behavioral piece. Sure, when you get down to the nitty gritty, we might want to think about like, right, you're losing muscle mass, so we probably want to do strength training, or you have damage to your heart and a cardiovascular damage, so we might want to do some cardiovascular training. Those things can play out. But what's underneath the most important to that is the consistency of doing it. If you are someone who doesn't really like strength training, but you love yoga and you do it 2 or 3 days a week, if you keep doing that during treatment, you're in a great spot. So there are times where we need to get specific about what type of exercise we do and kind of like the volume that we do. But underneath all that is, if you can habitually stay active and get a little bit more active throughout your treatment, it's going to be really powerful, because the odds are stacked against you. Like, sometimes when you get chemo, you'll get like anti-nausea medication, you get steroids, you get all these things that will kind of help buffer some of the side effects. But then they wear off and you can't sleep and you're getting sick and you don't have an appetite and everything tastes terrible. And then there's a term called cancer-related fatigue, which essentially says that the fatigue that someone experiences during cancer treatment is more profound and more persistent than any type of fatigue you could think about. And it's not alleviated by rest. So taking a nap in the afternoon doesn't fix it. And so counterintuitively, we have strong evidence that those people who are the most fatigued stand to benefit the most from being active, which we have evidence of that, but it's very difficult to say to your granddad who's lying in bed and is absolutely exhausted. We're saying, listen, just try get out and go for a walk for a few minutes, get around the block or whatever. When they're kind of going, well, I'm tired, I'm not going to do more stuff that's going to make me more tired. And so Yeah, the support that's needed, it really takes kind of, and to your point about caregivers, it takes a village of people to really support the individual going through the experience.
I think that's a good segue. Like for listeners who may be caregivers, what role can they play in encouraging exercise for their loved ones undergoing treatment?
Do it too. One of the really cool kind of emerging areas of research now that we're seeing is caregiver or dyad. So a dyad is basically referring to like the person with the experience and then whoever they're kind of like, caregiver, spouse. It could be like daughter, father thing. It could be like, cousin, whatever. Any sort of paired experience. Too often the caregiver carries the burden of like making sure they're there for their treatments and making sure they're taking their medicine. And as because you think about depression, right? Like depression is very common in oncology, and depression inherently is a selfish experience, and not in a negative term. It just means that like you are so consumed by what you're experiencing that you cannot look outside yourself, and it's really really tough to experience. At the same time, the experience of depression on the caregiver of someone with depression is so profound because you're trying to be their source of light and life daily, and it's really intense. And so we're starting to see some really cool stuff where we recognize the burden on the caregiver. So we're trying to have like couples exercise together. You get to come out and do the same training with them. So again, like if you're a caregiver, you're going to all their appointments, and you might be in the appointment. Sometimes you're sitting outside. You're bringing them to an exercise session and you just sit out in the corridor and they're getting all these benefits. That's not fair. So trying to engage them more in the activity can be really helpful. And then I think more and more cancer centers are recognizing that burden. So offering couples counseling and different things that make sure that the caregivers recognize for how much of a burden it is on them too.
Okay, that's positive. So the people are actually recognizing that caregiving in not just this situation, just in general, is an incredibly difficult thing, and there seems to be institutions and things being set up to support them too.
Yeah, with the caveat that again, it comes kind of down to like all this is almost an afterthought at most places. Like there is really progressive centers, but like again, you think about like over here in the States, like a Memorial Sloan Kettering is like the gold standard. That's a completely different experience to going to like South Dakota to a cancer center. So we need to keep, and it's kind of to your earlier point about the drive, like we need to just keep going to make sure that like we understand the full experience of a cancer diagnosis. I don't know if there's any chronic disease that has such a clear before and after. I can't speak to the experience because I've never had it, but overwhelmingly the feedback we get is this idea of a new normal. You have to completely reframe how you think about your life and your life experiences. So we're trying to recognize how broad that impact is on the person and their community of trying to get back. As a segue, or as a side note, one of the most fascinating parts to me, it's really challenging to help people who've never exercised gain the confidence to exercise, build the habits to routinely exercise, and then like build them up to a point where they're robust, tolerate exercise long enough to see benefits. So that's one really important challenge. What's really powerful as a challenge is cancer is anyone can get it. All this idea of like, maintain a healthy body weight and be active and have good nutrition is relevant, but young, fit, healthy people get cancer. And one of the more powerful experiences like I've seen anecdotally, I'm trying to develop a way to generate evidence for this, is the impact on athletes. So I'll give you an example. When I was working in the MLS, there was a professional soccer player who was a goalkeeper, and he had, I want to say it was leukemia, but he had a really intense chemotherapy regimen. And the regimens that he got, we know destroy your cardiovascular system. And some of that is irreversible. So it's very common for athletes who go through a cancer experience to never PR again. You have to come up with a new post-treatment PR. And he was speaking, the coaches were speaking about the experience of like, he came back after his treatment and he was kind of like, wasn't given a knowledge on his fitness test. He never got back to where he was. And I was like, listen, there is physiological evidence of like why that's never going to be possible for him. But if you have the attitude that it's only on his efforts, then you're nailing him for an experience that he had no control over.
Mm-hmm.
And so one of the really important experiences that I've seen is the changes in identity that happen with a cancer diagnosis. In the US, when people like the sport culture here is like pretty much college is the pinnacle. And unless you go professional, that's it, you're done. So you've got these lads who are playing in front of 100,000 people on in October or November or whatever, and then they don't make it professional sports, and then in January they're anonymous, and like the impact on their psychology is massive. In addition to maybe like someone tears their ACL and their career's over and stuff like that. We're trying to understand in the same way, what does a cancer experience do to an athlete's identity? Because your identity as an athlete is stripped away from you. And like it's kind of, it touches me because like I so strongly identify with someone who's active. When I'm injured or I can't be active, I am miserable to be around. Like I'm a nightmare. So we're trying to also, in addition to like help people who have never exercised and need help, we're also trying to generate support for those who are kind of more active as well.
Yeah, and it's probably something that's really lacking, and that identity piece really stood out to me. Like, I think in general, like if people, I know if you're a famous sports star and you retire, like that can be a tough transition. Like you said, if you pick up an injury early, and now you're bringing that down. Number one, you gave the example of college, so you're a bit younger, and then if you are like unfortunately sick, if you have cancer as well, like that's, like you said, it's a new normal. It's there's just so many facets being added to this, probably adding to the complexities of it as well.
Yeah. Yeah.
Yeah, that's fascinating. It's great that you're in that area and trying to develop that too. I don't know if you've any information around I did hear around like the AstroTurf pitches recently that a lot of like goalies in particular were more susceptible to things like cancer, given I think they were saying like the beads or like the tire kind of fabric in the.
Yeah. Look, listen, there's a lot of, like, that aside, there's a lot of different lifestyle factors that influence the risk of cancer, and ultimately it comes down to exposure and dose. I
Mhm.
think with that recognition, more and more people are trying to develop different types of synthetic materials that aren't as, say, carcinogenic, but like at least don't have the higher risk factor. But like, geez, man, there's one of the most powerful things I've seen in Western Australia, mesothelioma. Pleural mesothelioma is basically a cancer of the pleural space in the lungs, and it is rampant in Western Australia because in the 70s and 80s there were miners going down into these like underground places, being exposed to a lot of like aerosols and different things, essentially directly cause their mesothelioma. And so like there's some really powerful lifestyle things that do impact your risk of cancer, and it's just about managing that exposure and dose and stuff like that. The astro stuff is difficult because how do you tease out like specifically astro versus other lifestyle factors and what specific cancer to increase the risk of? But yeah, listen, if there's evidence there, I'd be mindful of how much I'm jumping on there.
Yeah, it just stood out to me when you mentioned in that example it was a goalie that just kind of like registered. I just remembered hearing that a few years ago. Ciaran, I'd love to kind of segue to talking about the future of exercise oncology. Like, where do you see the future of this? Where is it heading, and what excites you?
So much, man, so much. I think there's a few different areas. So firstly, we need to generate better evidence in more rare and more aggressive tumor type. So I mentioned earlier things like sarcoma. Sarcoma, like that's cancer of like, bones and muscles and stuff like that. Like you can have someone who has like half a leg removed, or a large part of their quad removed, or whatever. That's a life-changing experience, and tends to happen to younger people. Or say like advanced pancreatic cancer, that's more going to be like, how can we just like stop this gap? We're not going to recover people, but how can we slow the decline? So we need evidence in more rare types of cancer. We need better evidence in implementation science, which is kind of what your initial kind of conversation was around, like center by center. How do we develop a system where it's easier for us to go into any generic hospital and say, here's how we do this, here's how we implement this. The policy makers are huge, especially in this country, of like trying to build the evidence sufficient that insurance parties kind of go, yeah, this is what we're reimbursed for. And then I'm particularly interested in like the dose response effects. So what is the least someone can do that will benefit them? What is the most that they can tolerate that it's not that it's still safe? What is the type of activity and how much contact do we need to keep with people to make sure that they're still exercising 2 years later? So all those little intricacies I think are really fascinating. And then ultimately the tumor biology is another fascinating area. There's 5, to my knowledge, clinical trials ongoing that are looking at like in humans, if you exercise during treatment, how does it alter the treatment response? So they're probably going to take another 5 to 7 years to see like the full results of those trials. But those would be really interesting to see like if this early biological work in animal research has kind of like shaken out in humans. And then ultimately, man, like the biggest thing with this is like, it comes back to your original question of like, why should they? It's like, why shouldn't they? So in addition to the research, building out community infrastructure to make sure that like people in the community actually get access to this. Because the safety profile is really high, especially if you compare it to some of the pharmacological agents they're getting. It's way safer to exercise than it is to get chemo. It's not a case of like, should they? It's like, why shouldn't they? And how can we build infrastructure in the community to do it? So, like, engaging older adult assisted living programs, generating, online support resources. One of the really cool ways we look at it is alumni of our program. So, like, you've had people who've come through the program and got the benefits. Can they act as champions or even trainers in the community to build up support? Because, yeah, I think the ultimate goal is like anyone with cancer gets the choice whether or not they want to engage in this. And like, that's the ultimate goal.
Is it ever too late for a cancer survivor to start exercising?
Oh, that's such a good question. I would say no with the asterisks of this. The goal, because it's kind of all been like, yeah, we can help them recover. In the palliative stage, end of life, they're going to experience, they're going to pass away. The goal of exercise in that place is, can we keep you out of bed for an extra 3 weeks? Can we allow you to play with your kids or grandkids or whatever? And so it's one thing to say exercise can be really powerful in the palliative stage when someone's at the end of life, and it can help them kind of stay fitter longer and whatever. It's another thing to sit across from someone who has been told they've got 2 months to live. And if they say, listen, that's cool and all, but I want to go, spend the next 2 months by the lake eating pizza and drinking or whatever, who am I to say? So I think there can be benefit, but we also have to understand like the role that we play in the broader context of that person's life. The main goal of what we do is to understand the disease and the experience enough so that we can enable people to exercise safely and give them guidelines of how to do so, but not to kind of say you should. Because the second you start to say you should, then you're inherently putting blame on them if they don't. So it's more so saying like, listen, this is an option, it could be good, it can help you. But if you don't want to engage it, that's the personal choice. And someone with metastatic disease who wants to go and live by the lake, I'm kind of saying, yeah, I'm not going to stop you, go for it.
Yeah, and I think that like who like you said, who are you to say no? Come on, into
Yeah.
the gym you go. Ciaran, you're on the last minute, right? It's just it's going to wind down on the new Vibe app, and then you can just click the guest button to jump back in for just a few more questions, if that's all right with you.
Yeah, yeah, absolutely. Yeah.
While that is ticking down, one thing that stood out to me when you were speaking about what you're excited for, and it has to be an individualized approach. Like there's so many cancers out there, everyone is going through a different journey, everyone's affected differently. Like that would be a great spot to be in, that you're able to individualize programs and like setting up the community setting and the mental side of things. Like having it different for everyone is going to be incredibly key.
Yeah, and I think like when we jump back on, I can kind of talk about what we think that looks like as a phased approach as it mirrors kind of cardiac rehab and going from like specialized care to like general community programs.
Awesome. Yep, that sounds good.
We are chatting about the idea of kind of like the specialized care. We also have to be careful with that statement in making sure that doesn't prohibit a lot of people from getting access to really beneficial, lifestyle changes. So I mentioned cardiac rehab earlier, where stage one or phase one might be inpatient of like just getting you and helping you recover from this heart attack. And it requires like specialized exercise physiology to go through some intensive tests. You start to get a bit fitter, and then maybe you progress to phase two, which is like still inpatient, but you're in more of a progressive like exercise program. And then maybe phase three is outpatient, where you're coming and going and just kind of getting your checks. And then once you've gotten out of the red zone and you've kind of restored for the most part cardiovascular function, then you're free to join your local community center and do like a silver sneakers or an older adults class or even just general fitness. And so the same principle would apply in oncology, where there are absolutely times where we need specialized care. And importantly, that's going to be a balance between physical therapy and occupational therapy and exercise physiology. Because say lymphedema, for example, is very common in certain cancers, breast in particular, and it can be really painful. There's a lot of swelling in the limbs and fluid buildup and stuff. That needs specialized care from a physical therapist. But then that's only treating the affected limb. We as exercise physiologists need to treat the whole body and the system. Acutely, we need that like specialized care, but we want to do the same thing. Like if you're 10 years, like you hear this now and you had breast cancer 10 years ago, chances are you don't really need to come into the hospital to specialized care. You know what I mean? Like chances are you could probably go to a community center. Like in the US, there's some really good programs, like the Live Strong in particular is one that's a community program for people with cancer. So maybe you can go to something like that where it specializes in older adults or people with like aches and pains and groans and all the rest of it, which is like, again, trying to put people on that spectrum of like, there's times where you need the care, and maybe that's just reassurance that it's safe. But then there's times like broadly in the US, there's, I don't know how many million people like who have had a cancer experience in the past, we can't ask all them to come to the hospital and get their specialized care. So generating like safe community programs and educating upskill staff to make sure that that's accessible too.
I love it. There's actually, I don't know how, like, there seems like endless amount of work that you could be doing in this area.
Yeah,
Fair,
yeah,
fair play to you.
yeah. Yeah, I mean, yeah, it takes a lot.
What's one piece of advice you'd give to a cancer survivor who wants to maybe start rebuilding their strength?
I'll give you three. I think one would be find support, like whatever that looks like. If it's a caregiver or going into your community or finding some way to find support. So in Ireland, there's a phenomenal, if you look up like cancerrehabilitation.ie, maybe Trinity College in Dublin, there's a phenomenal group of researchers there that have developed a registry of all exercise and cancer community programs in the country. In the US, there's similar registries that are being built, one of which is by the American College of Sports Medicine, that again has all sorts of any state in the US, they're trying to build this registry of cancer related exercise programs. There's some really good free resources that can help you find maybe local support in your area. The second thing is be an advocate for yourself. It is one of the most frustrating things you see is people, hospitals are busy, medical care is really difficult and challenging, and there's a lot of nuance to it. But unless you're your strongest advocate, there's a chance that you get overlooked. And so, maybe having listened to this, you have a better understanding of how exercise can help. So you're banging on your doctor's door and saying, listen, I know we're talking about all this, but I also want to talk about exercise. Like, what do you have? What are your resources? And kind of be your own advocate. And then, like, I think to the third point would be to what you said. Any activity is better than none. It would be unhelpful for me to say you need to do 300 minutes a week of whatever type of activity. Like, that's not fair to someone who currently is sitting in bed too weak to get out of bed. So if standing up out of a chair is difficult for you, that then becomes the thing that you focus on. So anything more than what you're doing can be helpful. And then yeah, just look after yourself.
You're kind of touching on my next question, and as we do wrap up, I was wondering, is there anything you'd like to say to those who are listening and maybe going through cancer treatment or supporting a loved one?
Supporting a loved one, I think, is probably it's a really isolating experience because you're watching your person be celebrated and like have all the support and care around them, and being mindful of how that also shows up in a relationship dynamic of like, fuck yeah, they got all this care, they're getting all this stuff, and like I'm kind of doing all this to make sure that they can get care, and I'm kind of on my own. So I think it's important for the caregiver to make sure you find the same, like find some support, find ways to advocate for yourself, and make sure that you're looking after yourself. Like I think caregiver support it's so overlooked and so important, and making sure that the people in the community going through it can benefit.
Yeah, I think it's such important, such important a thing to call out, right? That I think, yeah, the caregiver can always be exactly in the name, like giving, 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 and sometimes maybe you could feel a bit lost, or like they also need someone to be giving to them, need some love in return. And I think it goes both ways. I think the caregiver never really thinks about it or acknowledges it because they're so focused on helping someone that they love
Yeah.
so dearly as well. Ciaran, where can people find you or learn more about your work?
I'm not on any social media, so nowhere really, unless you come looking for me. So I work at the University of South Carolina, and my email is public. If anyone wants to reach out to me, they can find me on email. I should probably be more active being out there, but yeah, that's about it. You can just find me through email.
Well, for someone who says that they're not on social media and should be more active, like I like you're incredibly engaging and easy to talk to as well. So if you do decide to go that route, like no doubt you'll be able to attract an audience and be successful. This was an absolute pleasure. Thank you so much for jumping on.
I appreciate it. No problem.
Yeah, really appreciate your time and get like especially the month that it is as well. And your topic is just so important. Yeah, and I just wish you, and I know all my listeners here, I got a few messages from people saying thank you for the conversation, that it's resonating with them as well. And just want to wish you all the best with your research in the future.
No, what at all, man. Happy to jump on anytime again.
Lovely. All right, Ciaran, thank you so much.